Welcome to Mad or Bad.
My name is Rachel.
And I'm Neil.
Today we are bringing you the story of Neils Hogel, a German nurse and serial killer estimated to have murdered between 100 and 200 of his patients over the span of 5 years. This fascinating case leaves as many questions unanswered as it does victims in its path. How did Hogel get away with murdering his patients for so long? And why would a nurse, the epitome of care and compassion, seek to murder in the first place?
Hogel was born on December the 20th, 1972, and raised in the German coastal town of Wilhelmshaven, I believe it's pronounced, Lower Saxony. Hogel comes from a nursing family. Both a grandmother and his father worked as nurses. His father formerly been employed at the St. Wilhad Hospital in Wilhelmshaven. Hogel decided early on in life to follow in his father's footsteps to train as a nurse. According to Hogel, he had a sheltered or protected childhood and was not exposed to violence at home in any way. He grew up in a strong Catholic family and described this as warm and stable. Talking to his former teachers and classmates, Hogel was described as friendly, helpful and fun. A news source quoted another person who grew up with him, stating he was in no way someone from the fringes. There was nothing remarkable at all about him, just an ordinary young man. At age 16, Hogel began training to become a nurse at the main hospital based in his hometown. Which is quite early, isn't it?
Yeah. I don't know how the educational system works.
18 in the UK, isn't it? The earliest? I don't know. He failed to make a strong impression, but colleagues and superiors remember him as being nice during the few years he spent there.
The nice guy facade soon began to shatter when Hogel was working as a nurse at a hospital in the northern city of Oldenburg. He started working here in 1999. The hospital had a very good reputation. However, Hogel at this time felt quite overwhelmed by his work in the cardiac surgery intensive care unit and started drinking heavily as he sank deeper and deeper into a depression spiked by his own feelings of low self-worth and self-esteem. In August of 2001, doctors and medical orderlies of the hospital ward 211 began discussing an unusual spike in both reanimations and deaths during the preceding months. I think reanimations, that's kind of a German term
Is that when...
for like...
when someone's dying or whatever, kind of flatlined or whatever?
Yeah, and they bring them back. I think it might be like a direct translation.
Yeah.
But I can't think of a word better to describe it, so yeah. Hey ho.
His thing was trying to get him back from the...
Yeah, so lots of cardiac arrests were happening and lots of deaths during those months that he started in August of 2001. So Hogel himself attended the aforementioned meeting. They had a meeting to discuss basically all of this stuff happening in the hospital.
We aforementioned the aforementioned meeting? Well, you mentioned it now. That's okay. Go on.
Okay. Most of the attempted reanimations and deaths were found to have occurred while Hogel was on duty. Hogel began to gain a reputation as something of a jinx, and colleagues sought to avoid working with him.
I mean, you would, wouldn't you? Do you know what I mean?
Yeah.
I think jinx is sort of a...
Yeah, but also, I was also one of those nurses who was called a bit of a jinx while I worked on acute.
Oh, Christ.
But I swear I wasn't killing anyone.
No.
It really was just bad luck.
I'm glad you. Yeah.
But people did not want to work with me for a while. Oh. Well, I kept finding people on the brink of death.
Well, that's how it goes sometimes, isn't it?
Yeah, it was just bad luck.
So after the meeting, he called in sick for the duration of 3 weeks. I mean, he could have been sick, but maybe he wasn't.
Maybe
I don't
he
know.
was just
possibly just want to keep out the
get
way.
away.
So during that time, only 2 patients in Ward 211 died, which, it might sound like, only 2, but it was a cardiac ward, wasn't it? So I guess,
Cardiac and intensive care.
Right, so intensive care, so obviously, yeah. So with only 2 patients dying, that was significantly fewer than had died prior to his sick leave. Statistically, 58% of all deaths at the hospital occurred when Hogel's on duty, which in itself is...
That says it all.
Yeah, you know, that's he's either very unlucky or there's something going on. So, under pressure by the cardiac surgery's head physician, Hogel was transferred to the anaesthesiology ward in 2001. I bet anaesthesiology ward were really happy with that, weren't they?
Sounds like a barrel alarm.
Yeah. Well,
I've never heard of an anaesthesiology ward.
no,
actually.
obviously we've heard of
What do they
anaesthesiology,
do?
but an actual ward. Do they have? What do they do? Do they just?
Oh, do you know what it is?
What?
That's when it's like an ICU ward,
Oh, right,
but with
okay.
ventilated patients actually.
Oh, right. So
So it's all the people who are under ventilation, because it's actually the anaesthetics team who take care.
okay. So they're not in ICU then. They go to.
Well, it's an ICU, but
Oh.
it would probably be just a special ward for
Okay.
only people who were ventilated,
Oh,
because
right.
it's usually the anaesthetics team that are in charge of their care, because obviously the main factors
Yeah.
with the person is the kind of the level of anaesthetic that they need, and they look, obviously they look at the airway, and that's, they manage that, Neil. They manage the airway.
Excellent.
So
So-
that's probably what that was.
The ward's head physician allegedly soon became suspicious of Hogel, as the latter was frequently present in emergency situations. So quite soon after he came there were suspicions arose. So in September 2002, the Oldenburg Clinic's head physician pressured Hogel to resign from his position at the hospital after multiple patients under Hogel's care had been found in life-threatening condition. For at that time, inexplicable reasons. It was suggested he either resign and continue to receive full wages for another 3 months, or transfer to the hospital's logistics unit where he would assist moving patients throughout the hospital.
It's pretty poor, though,
mean,
that they're
yeah.
just like, okay, look,
Yeah.
there's something going on.
We won't investigate
We're
it.
not going to look into it. We're not
Call
going to
the
ask
police.
questions.
Yeah.
Just resign, or look, we'll even pay you for 3 months full wage.
Yeah.
Just go somewhere else, please.
It's appalling, isn't it?
That is bad. That's really bad.
appalling.
And I mean, you know what? We're reading this, and I'm kind of almost thinking it's back in the 80s or 70s, but no.
Yeah.
This was only what, 15 years ago.
Yeah, in Germany, it's not like some
It's crazy.
a third world country or something. So, on 10th of October 2002, he actually received a reference letter issued by the Oldenburg Clinic's Director of Nursing. Therein, she testifies to Hogel's circumspect, diligent and autonomous work ethic, as well as him having acted prudently in an objectively correct manner in critical situations. I mean, I guess...
In a way, I guess he technically did, though. He technically did act in these
Well, he did.
critical situations.
Well,
he was the one, probably.
He was kind of making the critical situations, wasn't he? So, he was having a lot of practice. She also praises his devotedness and cooperative conduct. The letter also concludes with an overall assessment of Hogel having completed assigned tasks to the utmost satisfaction.
It's just a way of getting them out as soon as possible.
Yeah, I
but
mean,
it's like these people have a responsibility to
Absolutely.
protect their patients,
Absolutely.
to protect the general public, and they did none of that. They actually just let him continue for years.
It's appalling, isn't it?
It's
appalling.
Yeah, it's really bad. So in December of 2002, Hogel transferred to Klinikum Delmenhorst Hospital, where the emergencies and fatalities continued to occur, mostly when Hogel was on duty. Surprise, surprise. Within the first 4 months, a patient, Brigitte A., died under his care. Others, Hans S., Christoph K.,
Super
and
Hans.
Joseph Z. followed. Neil, these are people who've died.
I know, no. I know, absolutely.
I'm going to cut that.
No, don't cut that.
The deaths were mainly due to arrhythmias or sudden decreases in blood pressure.
Would you like to just describe, Rachel, with your vast physical healthcare experience,
An arrhythmia.
an arrhythmia?
It's just when.
I mean, I know, obviously, but I'm just asking you to.
Don't worry, Neil. I'll I'll tell you.
You teach me, yeah.
So basically, when the heart pumps, it's and normally, your normal pulse is called sinus rhythm. But there are lots of different conditions where you have an arrhythmia, which just means that the rhythm of the heart is not normal. But it can cause things like strokes or clots. So it can be potentially quite dangerous.
Thanks, Rach. Carry on.
So this led to some of his co-workers distancing themselves from Hogel. Off duty, Hogel rode along in an ambulance operated by the German Red Cross station. Hogel proceeded to live a fairly normal life outside of work and actually married in 2004, going on to have his first daughter in the same year.
He probably was involved in the birth, wasn't he? Probably instigated, kind of sped the labour up at home, wanted to be involved in that as well.
Jumped in on that as well. So he was allowed to continue this carnage in this neighbouring town where he practiced, even though colleagues had now nicknamed him Resuscitation Rambo.
So what exactly was Hogel doing to his patients? Hogel was administering a fatal heart medication to his patients called...
Ajmaline.
Ajmaline.
I don't know, I've never heard of it.
People who are given an overdose of this medication might start to feel dizzy, may feel a flutter in their chest before they begin to struggle to breathe and eventually lose consciousness. One doctor described it as if you're in the water and drowning, so...
As if you were in the water and drowning, yeah. Which sounds awful, doesn't it?
Yeah, dreadful.
Ooh.
The heart may stop or may not beat effectively enough to keep the person alive. Thus, the patient would require cardiopulmonary resuscitation, so CPR. CPR involves pressing heavily on the patient's chest in order to stimulate the heart to pump around the body. So the oxygen around the body.
Yeah, so you're pumping that blood around the body, you're keeping the person alive, basically.
This keeps the person alive until healthcare professionals can reverse the causes of the person losing consciousness. Many different tactics can be used to restart the heart, including doing a defib, or using a defib to shock the heart into returning to its normal rate and rhythm.
That's probably what you've seen on telly when they shock. You know, they have the two paddles.
And that's
and
what...
They're like, clear! And then they shock.
Well, we don't actually use the paddles, do we? When we do our training, we just use the defib and the two pads.
Yeah, it depends where you work, though.
But not paddles.
The paddles come with the monitor, which shows you the rhythm. So if you're a doctor and you know what you're doing, you can basically make a decision as to whether to shock the heart or not.
We're never trained with those, are we?
No, because we're mental health, obviously. We're not fair. Well, we are.
No,
we're quite up on physical health. It's just we don't have that level of expertise.
Well, the defib that we use, nowadays you see defibs, don't you, in old red telephone boxes and on walls and stuff like that. Well, that's just a defib that we've got, isn't it?
Yeah, like a community defib.
But it's more about reversible causes, isn't it, that we
And that defib, it basically recognises if it needs to shock or not. Because there's only certain rhythms that are shockable anyway. So it might not be effective.
So even in hospital, CPR is not very effective, and its success rate is 17 to 20%. However, that doesn't sound, that's kind of 1 in 5. But without it, the patient's dead anyway, aren't they?
Well, yeah. So
I think community, it's even lower than that, isn't it? It's about 8 to 10%, something like that.
Yeah, and when you think about CPR as well, though, I'm sure both of us have been involved in CPR with patients, and